Breast cancer is the most common form of cancer in women. Brenda Smith from the Pasadena Breast Wellness Center is here to tell us about a new screening technology. Brenda, so you have this SureTouch digital breast exam. Tell us about this.
SureTouch was approved by the FDA in 2003, and it's a tactile system. So basically the sensor will feel for any masses that are in the breast. It amplifies anything as small as 5 centimeters, so it will detect a mass even sooner than a mammogram will. It's non-invasive, it's comfortable, no squish, and no radiation.
Well, what about accuracy though?
Very, very accurate. Studies have shown that it's as accurate as an ultrasound, but it doesn't require the interpretation, and there's no wait to get results. You get results right away.
So since we're dealing with like a high percentage of accuracy, I mean, do you test less frequently than you would like with, let's say, a mammogram?
Not necessarily. Women usually will come in once a year. I mean, that's what we're recommending. That's the standard of care to detect something. But if there are masses that we want to keep an eye on, the SureTouch is really, really easy to come in and get checked at 3 months, 6 months, because you're not getting exposed to any radiation.
What about women with dense breasts?
It's perfect for that because the system creates a map of your normal tissue and then looks for anything that's abnormal from that profile, so it works perfectly.
Why aren't more people using this? I've never heard of this.
Well, that's the problem, is that nobody's heard of it. So the company has reached out to those of us on the other side of the medical model as alternative practitioners. I'm a licensed acupuncturist and herbalist, and we're taking the lead on this, on getting this technology out and letting women know that this is available.
You had mentioned it was approved back in 2003, correct? Why did it take so long for people to just start finding out of it, like literally just now?
Actually, I'm not sure. I found out about it about a year ago, and as soon as I heard about it, I called the company and wanted to get involved. So I'm leading the force here in the Pasadena area to get this exposed to the public.
As far as the procedure, is it an afternoon the patient will be spending with a doctor? Or?
Oh, no. It's 15 to 20 minutes, maybe 30 depending on if there is a lot of fibrocystic tissue, and we have to make sure that we get through all of it. But it's very simple, very easy, and it's very comfortable.
Now you mentioned that this company is reaching out to people, doing alternative medicine. You're an acupuncturist, but why would someone come to you for something like this?
As opposed to going for a mammogram?
Yeah, exactly.
Well, that's the problem, is that an average of 50% of women are not getting screened, and that's not wise either. And they're not getting screened because of the process.
Really, that high?
It's very high.
Wow.
Between insured and uninsured women. So doing nothing is not good. So we're sending the message that for those 50% of women that are objecting to the mammogram and are uncomfortable with that, they need to get screened, and this is an option that they can choose.
Are you? Go ahead.
No. You were just mentioning the 50%, so that's 30% of insured women and 60% of uninsured women.
Correct.
That's a really high number.
It's very, very high.
And
are you finding more and more doctors are practicing this method?
We have a lot of excitement in the medical community. A lot of the physicians that see it are very excited about it, but because of the current standard of care, I think it's a little bit conflicting for them sometimes. So we're having some physicians that are starting to refer their patients to me, and again, it's usually the women that just object to having the traditional mammogram.
But I mean, someone doesn't have to be a licensed radiologist to do this exam. I mean, who can perform
No, actually,
this procedure?
I've been trained, but I have a nurse. She's an RN BSN who is herself a cancer survivor, and she's the one that administers the test.
So it opens up on who can do it.
Correct.
Now, what if you get a positive result? What do you do next?
We send them to their physician for the standard of care. So if we do find something, if we find a lesion that's suspicious, we make sure that they get to their doctor with the report, because they do get a printed report at the end.
Now, upon a positive diagnosis, and let's say things are on the mend, would you recommend this sort of treatment as sort of like, a checkup to see how far the procedure's going? Or?
Yes, we have one woman who has a history of breast cancer, and she's been in once a month to check on what's going on, and she's doing great.
Okay. Well, I know they can go to your website, brendabsmith.com, to find out about a booby party that you're hosting on the 29th.
Yes.
To get more information out there for people.
Absolutely.
All right. Well, thank you, Brenda. This
you.
is just amazing technology, and I want to hear more about it, so thanks for telling people.
Thanks for having me.